Andrew, just to explain who you are and how you feel about Westbury Community Hospital, really.
Well, I'm Andrew Murrison. I was until very recently the Member of Parliament for the Westbury constituency, which became South West Wiltshire, and I'm now a candidate in the election. I've been associated with this hospital for 14 years, which is how long I've been an MP for. But before that, with community hospitals more generally, from the age of 17, when I had my first job as a part-time hospital porter whilst I was still at school. So professionally and politically, I feel I understand a bit about community hospitals. I think the interesting thing about this particular community hospital is the huge sense of ownership that people in Westbury feel for it, having given very generously over many years to it and having volunteered for it and supporting it over a long time. I think the other point is the need for community hospital beds has not gone away, and this was brought home to me very clearly recently when a friend of mine had his operation cancelled again at the RUH because of pressure on acute beds. Our NHS always does run hot, as it were, because we try to get the most out of it we can. That means that sometimes pressures build up, and that's why we have cancellations, it seems to me, too frequently, because when they happen, not only are they deeply distressing, they're also costly in terms of general waste within the system. And I think we need to do what we can to avoid that situation. It seems to me that unblocking acute hospital beds is an important part of that mix, and to do so you need step-down care of the sort that community hospitals certainly provide. So I think there is a need, an unfulfilled need, and one I think we need to address. And it gets worse than that because our demographic is ageing. With age comes illness and the need for intermediate care. The worst place you can put a person with complex and multiple needs is into an acute hospital unless they really do need to be there. And as we go forward into an era within healthcare, which I think is going to see us focus far more on regional and sub-regional centres, because that's where the imperative is to drive up quality within healthcare and achieve best outcomes. It will increasingly leave a gap in healthcare close to where people live, and I think therefore my vision is that community hospitals will be a much bigger part of our healthcare mix in the future. If you get the case mix right, they can give care very cost effectively, so we need to be planning for that. And my worry is that if we get rid of assets now, it's going to be much more difficult to recreate them in the future. I think in Westbury we've done quite well in the sense that we have a new medical centre. I commend the CCG, the Clinical Commission Group, for that. It's very good, really very good, and vastly improvement on the old Eastleigh surgery, which was inadequate for Westbury. So I think we've made progress, but I do worry about the lack of intermediate care beds.
Okay, thoughts on the dementia unit?
Well, firstly, I think well done to the Clinical Commissioning Group for identifying the need for a specialist dementia care unit. I think in Wiltshire definitely there's a need for it. But I'm a little bit perplexed about the chosen location and also the process that we went through to get where we are. It seems to me that Salisbury isn't going to be much use to my constituents, particularly since this plan will involve the closure of Charterhouse in Trowbridge. So it's a long way to expect very vulnerable people to go and their carers. So I doubt it's going to be of any use to people in the north and west of Wiltshire. Alternative provision is going to have to be made for them. I'm interested to know precisely what that will look like. I'm also concerned about the consultation exercise that Healthwatch undertook on behalf of the CCG. I'm concerned about the methodology, who was consulted, And I'm also worried about some of the financial aspects of the calculus that has been made, so I'm still in correspondence with the clinical commission group to ask why it was that Westbury wasn't one of the initial possible locations for this, and why it is that the consultation looks a little bit odd, and I'm awaiting a response from the CCG on that at the moment.
Well, thank you for that, Andrew, and can we just wish you the best for the election that's coming up, the general election, and also Stop, as I know, will be very grateful for this interview.
Thank you, it's a pleasure.